Hello everyone. My name is Haley Johnson, and for my article critique presentation, I will be discussing the article Use of Opioids During Pregnancy and Effects on Pregnancy Outcomes by Faltmarch, which was published in 2019. Okay, to start off, it's really important to understand why this topic matters. The prenatal stage is one of the most important stages in human development. During this time, major body systems and organs are forming, which makes the fetus especially sensitive to outside influences. According to our textbook, though, exposure to certain substances during this stage can increase the risk of developmental problems or pregnancy complications. At the same time, though, opioids are commonly prescribed for pain management, but because these medications are widely used, researchers want to understand whether taking them during pregnancy might affect birth outcomes. Okay, what's next? Let's see. Okay, so the main goal of this study was to determine whether opioid use during pregnancy is associated with negative pregnancy outcomes. Specifically, though, the researchers wanted to compare two groups of women, obviously women who had used opioid prescriptions during pregnancy, and then obviously the ones who did not. By comparing these two groups, though, they had hoped to see whether the opioid exposure was linked to a higher risk of complications during pregnancy or delivery. The researchers focused on several specific pregnancy outcomes, which included preterm birth, which means the baby is born earlier than it was expected to be. They also looked at the low birth weight, which can indicate problems with fetal growth. Another thing that was examined was cesarean deliveries, which can sometimes occur when there are complications during pregnancy or labor. And then lastly, we have babies being born small for their gestational age, which means they're smaller than the typical stage of pregnancy they were born at. Okay, anyways, to conduct the study, the researchers used a national medical registry data from Finland, and it allowed them to analyze information from a larger number of pregnancies across their country. Obviously, it was an observational study. The sample included women who gave birth to single infants during the study time period. Women had at least one opioid prescription during the pregnancy, were considered part of the opioid exposure group, and then the women who did not receive any prescriptions were placed on the comparison group. Okay, so the researchers controlled for several factors that might influence pregnancy outcomes. Those include the maternal age of the mother, if the mother was a smoker or not, and then the socioeconomic status of the mom. The controlling for these factors helps make the comparison between groups more accurate. In other words, it helps ensure the differences in the pregnancy outcomes are not simply caused by other factors unrelated to, opioid use. Okay, so the results of the study showed that opioid use during pregnancy was associated with a higher risk of several complications. Women who used opioids during pregnancy were more likely to experience preterm birth. They also found higher rates of low birth weight and babies being small for their gestational age. And then the women who had used opioids had higher risk of cesarean deliveries as well. However, this doesn't mean that every pregnancy involving opioid use resulted in complications. It's just an overall trend showing increased risk compared to pregnancies with opioid exposure. Okay, so the study connects closely to the concept of teratogens, which we learned in class, and it's also in our textbook, but teratogens are substances that can potentially harm a developing fetus. Opioids may act as the teratogen because they can increase the likelihood of complications during pregnancies. But that doesn't mean teratogens always cause harm. Their effects often depend on factors such as timing, exposure, dosage, and then the individual differences between pregnancies. So it's important understanding when and how substances are used during pregnancies. Okay, so I would say the most important thing I learned from this article is how sensitive the prenatal stage is. During this time, the fetus is developing very rapidly, and any like small changes in the environment can sometimes have significant effects. It kind of highlights why healthcare providers often emphasize avoiding certain substances during pregnancy and being cautious, like with medications and whatnot. It also shows how critical early development is for long-term birth. So, those are my first important takeaways, and let's moving on. Okay, so the second important thing I got from the study was understanding the limitations of the research. The study obviously was an observational study, which means they examined the existing medical data rather than conducting a new controlled experiment. I think though, because of this, the researchers can't actually sit there and say opioid use directly causes these complications, but instead the study shows how there's an association between opioid use and the higher risk of negative outcomes. There's also not other factors captured in the data, such as stress, mental health, and whatnot. And then obviously a real life application of the research is that it relates to medical decision making. Our healthcare providers really need to carefully consider whether prescribing opioids during pregnancy is actually necessary. Some doctors may need to weigh potential benefits of pain management against the possible risk factors to fetal development. I think in some cases though there's safer alternatives to opioids and they might be considered when possible. So yeah. Okay, so another application involves education and awareness. I think pregnant women or people planning to become pregnant could benefit from learning about how certain substances may affect fetal development. I think increasing awareness about the risk may help individuals make safer choices during pregnancy. And then also encouraging healthcare providers to discuss medications more openly with their patients could help. Okay, so even though the study provides useful information, there's obviously going to be some limitations. One of those include the prescription records. They don't necessarily confirm whether the medication was actually taken. Another limitation is that the researchers did not have detailed information about dosage or how frequently the medications were actually being used. And then also the data came from Finland, and healthcare systems and prescription practices differ in other countries. So these findings can't necessarily be applied to every other country. Okay, so overall the study suggests that opioid use during pregnancy may increase the risk of several complications, those including preterm birth and low birth weight. But that doesn't necessarily guarantee that the use of opioids is going to cause a negative outcome. The research shows us that there's a higher level of risk compared to pregnancies without opioid exposure. I think these findings highlight the importance of protecting fetal development during the pregnancy stage and being cautious with medications during pregnancy. Okay, so that nearly wraps up my presentation. Thank you very much for sticking around this almost 9 minutes. We're almost there. I'm kind of stalling right now, so we can meet it there. I hope you enjoyed watching this as much as I disliked making it. To end the presentation though, these are my references. The first one is the article I chose for the AC1, and the second one is obviously our class textbook. Thank you.